Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I came in because I need some refills, and I've been having some issues with my blood sugar and pain. I've noticed my sugar levels have been really high lately, often between 250 to 400, and that's a bit concerning. I've been trying to manage it with insulin, and we recently increased the dose from 22 to 26 units daily.
I see you've made adjustments to your insulin. How have you been feeling overall with these changes?
Honestly, not great. I've been having more wrist and knuckle pain on the left side, and my feet swell up by the end of the day. I also have this chronic knee pain. It flares up now and then, and the last time it was quite bad, I had to take steroids for it.
You mentioned needing refills on several medications, including something for the pain and the swelling. Let's make sure to address those today. Can you tell me more about your recent episode with gout and how often you experience these flare-ups?
The gout pops up every few months, I guess. It gets pretty painful, and the steroids help, but I know they're not a long-term solution. Plus, my knee hasn't been the same since the last flare-up.
It's important we manage these acute episodes effectively, but also look at preventive strategies. How about your activities? Any difficulty with daily movements?
Well, there's this thing. I can hardly walk a block without feeling short of breath. It's not just the pain, but I feel so winded and tired. I don't know if it's my heart or what. I live with my granddaughter, and she's been a huge help, but I hate feeling so dependent.
Living with family can be a great support. It's good to hear she's there for you. We'll check your heart function and make sure there's nothing else contributing to this breathlessness. What about your diet and managing your diabetes?
Diet-wise, I try to keep things simple and avoid sugar as much as possible, but with diabetes, it feels like I'm always playing catch-up. My granddaughter helps with meals, but sometimes I cheat a little.
Sticking to a diet can be challenging, but it's crucial, especially with your blood sugar levels. We might need to look at other medications if insulin adjustments aren't enough. Tell me about any other symptoms you've had recently.
I've had some trouble sleeping, which is why I sometimes take codeine. It helps a bit. Then there's the bathroom issue. I find myself getting up 2 or 3 times at night, and I've had episodes of palpitations, which haven't been checked yet.
Nocturia and palpitations could be related to several things, including your heart or medications. We'll need to investigate this further. Let's also make sure we're managing your constipation and any other gastrointestinal issues effectively. Based on what we've discussed, here's what we'll do next. Your blood pressure today is 144/72, which is relatively stable. However, your blood sugar levels are concerning, and your HbA1c is at 9.2%, indicating that your diabetes is not well controlled. Your kidney function shows some impairment with a creatinine level of 1.4 mg/L and an eGFR of 55, suggesting moderate chronic kidney disease. We'll need to monitor this closely. For your wrist and knuckle pain, the X-ray didn't show any fractures, but did reveal mild osteoarthritic changes. We'll continue with pain management and possibly consult a specialist to explore more sustainable options than steroids. The swelling in your feet and difficulty with mobility could be related to both your joint issues and possibly your heart, given the shortness of breath you mentioned. Here's our plan. Increase your insulin dosage to 26 units daily as already adjusted. Refill your prescriptions for constipation and sleep issues. Set up a consultation with a pharmacist in 3 to 4 weeks to reevaluate your medication regimen and ensure your monitoring devices are accurate. Schedule a follow-up with me in 3 months, but I want you to come in sooner if your symptoms worsen or if you have concerns about your heart or breathing. We'll also ensure you receive the appropriate diabetic-friendly nutritional supplements. I'm ordering an ECG to check on the palpitations and recommend a sleep study to address your nocturia and sleep issues comprehensively. We'll keep a close eye on all these aspects, and I'll coordinate with your other healthcare providers to make sure we're all on the same page. Is there anything else you'd like to discuss today?
No, that covers everything. I appreciate your help sorting all this out.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been having a really tough time lately with my fibromyalgia symptoms getting worse. I was under the impression that a rheumatology consultation had been set up, but I haven't received any confirmation or a date yet.
I understand your concern. It's crucial that we get you seen by a rheumatologist soon. I will follow up with the department to ensure that your appointment is scheduled as soon as possible. Can you describe how your symptoms have been worsening?
Sure, it's been mainly an increase in my overall pain levels, more frequent flare-ups, and it's been much harder to manage the pain. It's affecting my sleep and daily activities a lot more than before. I've been trying to manage it with the usual pain relief methods, but they just aren't cutting it anymore.
That sounds quite challenging. Let's make sure we address each of your concerns today. How about your Achilles tendonitis? You mentioned persistent swelling and pain.
Yes, the pain has been constant, and the swelling hasn't gone down much. I've been using some over-the-counter insoles, but they don't seem to do much. Another doctor mentioned steroid injections as a possibility.
Steroid injections can be an option for reducing inflammation and pain. However, it's also important to use the right kind of support for your feet. We might consider something more specific, like heel cups, which can help relieve pressure on the Achilles tendon better than standard insoles.
I'll try anything that might help at this point. And my skin, the eczema on my legs, it's gotten worse too. I've been using baby oil and petroleum jelly, but there's no real improvement.
For your eczema, I recommend switching to Hydroxy Cream. It's a more effective moisturizer and could provide the relief you need from the dryness and itching.
Okay, I'll switch to that. Then there's my throat. Ever since my tonsillectomy, it's been constantly irritated. I've been using salt water to gargle, which provides temporary relief, but it's not enough.
The chronic irritation could be due to post-nasal drip. I think a steroid nasal spray could help reduce the inflammation and give you more relief. It's worth trying to see if it eases the irritation.
I'm willing to try that. I just feel overwhelmed by everything sometimes. The constant pain, the skin issues, and now my throat. It all just adds up.
I can see how hard this has been on you. Managing multiple chronic conditions can be very challenging. It's important that you don't have to go through this alone. We'll coordinate your care across your conditions and make sure you're supported every step of the way.
Thank you, doctor. I appreciate that. It's just been a lot to handle.
Absolutely, and you're doing your best. Let's go over your current status and plan moving forward based on today's assessment. Your vital signs today are stable. Your blood pressure is 130/85 mmHg, heart rate at 78 BPM, respiratory rate at 16 breaths per minute, temperature at 98.6 degrees, and your oxygen saturation is at 98% on room air. Your physical examination showed moderate bilateral swelling with erythema in your feet, and palpation of the Achilles tendon elicited a pain response, especially on the right. The skin examination confirmed dry scaly patches, more severe on your right leg. Your lab results show an elevated CRP at 10 milligrams per liter and ESR at 30 millimeters per hour, which correlates with inflammation likely related to your fibromyalgia and other inflammatory conditions. Creatinine and BUN levels are within normal ranges, which is good news regarding your kidney function.
That's a lot of information, but I'm glad to know where things stand.
Based on this, our management plan will include an urgent follow-up with rheumatology to address your fibromyalgia. We'll schedule a follow-up appointment in 3 months, but you can come in sooner if your symptoms worsen or you have concerns.
That sounds like a comprehensive plan. I hope these changes make a difference. Thanks for all your help today.
You're welcome. Remember, we're here to support you. Don't hesitate to reach out if you need anything before our next appointment. Take care.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
I've noticed you've been feeling quite unwell with symptoms like vomiting and fatigue after starting the new medication. These are common side effects.
Yes, it's been really tough. Is there anything that can be done to reduce these effects?
Definitely. For vomiting, we could consider medications to help ease nausea. Eating smaller, more frequent meals might also help. Regarding fatigue, it's important to balance your activity levels and allow for plenty of rest.
I struggle with eating because of the nausea. Are there specific types of foods that would be easier to handle?
Bland foods like toast, rice, and bananas can be easier on your stomach. Also, staying hydrated is crucial, even if you're only sipping water little by little throughout the day.
And what about my daily activities?
Let's tailor your activities to how you're feeling. On good days, light exercise like walking might be beneficial. On tougher days, it's okay to rest. The key is listening to your body and not overdoing it. We can keep adjusting your plan as we go along to find what works best for you.
Now look at question 26.
Elderly women face unique challenges in healthcare, particularly in terms of social isolation, which can negatively affect their health outcomes.
Indeed, and mobility issues further complicate access to necessary health services, contributing to their isolation.
Financial barriers also play a significant role, as many are on fixed incomes and struggle with the costs of medications and healthy food options.
We need to consider these factors when developing support systems and interventions tailored to their needs. For instance, community-based programs that provide transportation and social interaction opportunities can make a big difference.
Health education tailored to their needs can empower them to take charge of their health and navigate the healthcare system more effectively.
Absolutely, and integrating technology in a user-friendly manner can help bridge some of these gaps, allowing for better communication with providers and access to health information.
Now look at question 27.
To manage your condition, a diet modification is essential. We need to focus on increasing your intake of fiber and cutting back on sodium, which can significantly affect your health.
What changes should I make to my diet specifically?
Start by incorporating more fruits and vegetables into your meals. Aim for whole grains over refined ones and choose lean protein sources like fish and poultry. Also, try to limit processed foods which tend to be high in salt.
That sounds doable. How about dairy and fats?
Opt for low-fat dairy options, and when it comes to fats, focus on healthy ones like olive oil and nuts. Avoid trans fats completely. I'll provide you with a detailed plan and some recipes to get started.
I appreciate it. How often should we review my diet and progress?
Let's schedule monthly checkups to see how you're doing and make any necessary adjustments. It's important to monitor your health and tweak the plan as needed.
Now look at question 28.
Let's focus on our patient on the ventilator. We've seen some improvements, but there are ongoing challenges with their respiratory metrics. What's the latest update?
The patient's oxygen levels have been more stable, but they still require significant ventilatory support. I recommend maintaining our current settings and continuing to monitor closely.
On the nursing side, we're ensuring that the patient is comfortable and preventing any secondary infections, which are a risk with long-term ventilation.
From a physiotherapy perspective, I've been working on gentle exercises to help maintain muscle tone and assist with respiratory effort. Increasing these activities could benefit their recovery.
Excellent points. Let's implement these suggestions and meet again in 48 hours to assess any changes. It's crucial we stay proactive in our approach.
Now look at question 29.
Adhering to your medication schedule is crucial for managing your condition effectively. Missing doses can significantly hinder your progress.
I've had trouble remembering to take them, especially on days I feel okay. It makes me think I don't need them.
It's a common thought, but your medications are designed to maintain your health consistently, not just treat symptoms when they're apparent. Consider them as part of your daily routine, like eating or sleeping.
Do you have any tips for remembering?
Setting alarms on your phone is a good strategy. You could also keep your medications in a visible place where you'll see them regularly. How about aligning your medication times with daily activities like meals?
That might work. I'll try aligning them with my breakfast and dinner. Thanks for the suggestions.
Now look at question 30.
The integration of AI in diagnosing medical conditions can revolutionize healthcare by providing fast and accurate assessments, reducing the workload on professionals.
Speed and accuracy are undeniable benefits, but we must also consider the human element. Diagnoses affect people's lives deeply, and AI lacks the capacity to understand patient emotions and the subtleties of human interaction.
That's valid, but AI doesn't replace doctors, it aids them. By handling initial data processing, AI allows healthcare professionals to focus on patient care aspects that require human empathy and judgment.
Ensuring that AI tools are accessible across all levels of healthcare facilities is crucial to prevent a divide in care quality. We need regulations to manage how AI is used in clinical settings, to ensure it complements rather than complicates healthcare delivery.
Agreed. The goal is to enhance, not replace, the human aspects of healthcare. Effective integration requires thoughtful implementation and ongoing evaluation to benefit all patients equitably.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Good evening, everyone. I am honored to address you today on a topic that is both timely and urgent: the intersections of climate change and kidney disease. Our discussion will delve into how climate-related changes are impacting renal health and explore strategies for healthcare systems and practitioners to adapt to these evolving challenges. Let's start by considering a case that illustrates the direct effects of climate change on renal health. In 2019, a 52-year-old male patient, whom we shall refer to as Mr. Smith, presented to the emergency department in a southwestern U.S. city during an unusually severe heat wave. Mr. Smith was a construction worker, typically spending about 8 hours daily outdoors. He had a history of controlled hypertension, but no known kidney issues. During this heat wave, temperatures soared above 40 degrees Celsius, 104 degrees Fahrenheit. Mr. Smith, on that day, experienced symptoms of nausea, muscle cramps, and lethargy, which he initially attributed to the heat alone. However, upon arrival at the hospital, laboratory tests revealed acute kidney injury, AKI. His serum creatinine was 2.5 milligrams per deciliter, elevated from a baseline of 1.0 milligrams per deciliter. Further history disclosed inadequate water intake and direct sun exposure for several hours. This case exemplifies a condition known as heat-related nephropathy, which has become increasingly prevalent in certain parts of the world. Research, such as that by Johnson et al. 2020 in the Journal of Clinical Nephrology, indicates that repeated episodes of dehydration and heat stress may lead to chronic kidney disease of unknown etiology, especially in outdoor workers. Now, let's explore the science behind this phenomenon. Prolonged heat exposure and dehydration induce renal hypoperfusion and ischemia. This condition exacerbates the generation of reactive oxygen species and a cascade of inflammatory responses in renal tissues, leading to tubular injury. Over time, repeated acute kidney injuries can progress to chronic kidney disease, particularly in the absence of adequate recovery periods and hydration strategies. The implications for healthcare systems and providers are profound. Firstly, there is a need for heightened awareness among healthcare professionals about the potential renal complications of heat exposure and dehydration. Educational programs should emphasize the importance of early recognition and management of heat-related illnesses, particularly in vulnerable populations such as outdoor workers, the elderly, and those with pre-existing health conditions. Secondly, public health initiatives must prioritize climate adaptation strategies. These could include community hydration stations, heat alerts, and modified work schedules during extreme heat episodes. Furthermore, policies should support research into sustainable practices that mitigate the environmental impact of healthcare itself, as highlighted in a 2019 article by Thompson et al. In the Harvard Environmental Law Review. This research points out that the healthcare sector is a significant contributor to global greenhouse gas emissions, which exacerbate climate change, thereby closing a vicious cycle. Moreover, on an individual level, healthcare providers can advocate for and educate their patients about the importance of hydration and protective measures against heat exposure. For instance, Mr. Smith's case could have been mitigated if there had been stricter guidelines for water breaks and shaded rest periods on job sites. As climate change continues to affect global weather patterns, the incidence of heat-related renal damage is likely to increase. It is imperative that we, as healthcare professionals, recognize the connection between our changing environment and renal health. By integrating climate considerations into clinical practice, we not only improve patient care, but also contribute to broader public health resilience against the impacts of climate change. Thank you for your attention, and I look forward to our continued discussion and any questions you might have.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Welcome to our Advanced Healthcare Seminar Series. Today, we delve deep into the emerging trends and challenges in the treatment of multi-drug-resistant infections, a critical area that's been gaining attention in both clinical and research domains. Our focus will be on a complex case study which illuminates the difficulties and strategies in managing such conditions, particularly in the context of healthcare-associated infections. Let's first establish the landscape of our discussion. Multi-drug-resistant organisms, or MDROs, present a formidable challenge in modern medicine. These pathogens, which include MRSA, VRE, and various forms of resistant gram-negative bacteria, have developed mechanisms to evade the most commonly used antimicrobials, leading to limited treatment options and higher healthcare costs. The case we are examining today involves a 58-year-old male patient, Mr. Smith, who was admitted to the hospital with a severe case of pneumonia. Initially treated with standard antibiotic therapy, his condition did not improve, prompting further investigation. Cultures confirmed the presence of a multi-drug-resistant Pseudomonas aeruginosa, a finding that significantly complicated his treatment plan. In addressing cases like Mr. Smith's, our approach must be multifaceted. It starts with accurate and rapid diagnostic methods. The importance of timely identification of the specific MDRO cannot be overstated, as it directly impacts the selection of the appropriate antibiotic regimen. In Mr. Smith's case, once the pathogen was identified, a tailored therapy using a combination of antibiotics to which the isolate was found to be susceptible was initiated. This strategy, known as combination therapy, has been advocated in treating severe infections caused by such resistant bacteria, as it may reduce the risk of treatment failure. Another critical aspect we must consider is the role of infection control measures in preventing the spread of MDROs within healthcare settings. In Mr. Smith's scenario, strict infection control protocols were implemented, including isolation procedures and the use of personal protective equipment, PPE, by the healthcare staff. These measures are essential to prevent cross-transmission to other vulnerable patients in the hospital. Moreover, the use of antimicrobial stewardship programs, ASPs, has shown promise in managing MDROs by optimizing antibiotic use to reduce resistance spread. ASPs guide the healthcare team in choosing the right drug, dose, and duration of antibiotic therapy, which is crucial in treating infections while mitigating the risk of developing resistance. Research also plays a pivotal role in our fight against MDROs. Recent studies have focused on understanding the genetic makeup of these organisms, which helps in predicting resistance patterns and developing novel antibiotics. For instance, a study published in the Journal of Clinical Microbiology highlighted the potential of genotypic testing in identifying resistance genes, which could lead to more targeted and effective treatments. Managing multi-drug-resistant infections requires an integrated approach involving accurate diagnostics, effective treatment strategies, stringent infection control measures, and continuous research. Each of these components is crucial in improving patient outcomes and combating the broader issue of antibiotic resistance. To wrap up, let's reflect on the broader implications of our discussion today. The case of Mr. Smith is not isolated. It represents a growing number of similar challenges faced globally. As healthcare providers, our actions and decisions play a vital role in shaping the future trajectory of antimicrobial resistance. It is imperative that we continue to engage in scholarly discussions, participate in research, and apply best practices in clinical care to address this pressing global health threat effectively.